So it's huge numbers, about 1 in 4 of the patient with posterior circulation stroke present isolated volume, but nobody paid attention to this statement. They just remember that, no, isolated volume never comes from a stroke, so we don't need to worry about the vascular problems. But that's not true. So this is the paper, I believe, the first paper that drew attention to the isolated vertigo in cerebrovascular disorder, especially in cerebellar infarction.
Professor Ji-Soo Kim, a leading expert in the field of neurology, presented a new concept in vascular vertigo. He insisted on bedside examination and showed through a lot of interesting cases how to differentiate a central from peripheral lesion in acute vestibular syndrome. He warned us not to rely on MRI in the acute stage.
You still believe that he got stroke? Yes. You should believe yourself. Don't be fooled by imaging. In my experience, head impulse test is the most valuable sign to differentiate the vertigo from the peripheral vascular lesion and the vertigo from central lesions such as strokes.
The lectures helped me to understand a little bit better how to differentiate between the peripheral and the central causes of vertigo, which is the still very hard question to answer when you work in an emergency department.
Dr. Andreas Zwerkel from the German Center for Balance Disorders provided insight into the dilemmas that central vestibular presentations create. His lecture was illustrated with interesting videos and showed promising results in treating patients with cerebellar ataxias.
Development of the last few years that some new drug agents have been tested for cerebellar disorders, and we can say that we have around 10 years of experience with aminopyridines working for certain types of nystagmus of cerebellar origin, for example downbeat nystagmus or central positioning nystagmus, and we have some new agents which are just undergoing some further testing and which may be positive for postural and gait symptoms of cerebellar syndromes.
Where are you from?
From Hungary.
Okay. And do you like the lectures?
Yes, I like it very much. And I were here last year too.
Oh.
Yes.
And what you learned today?
I am an ENT doctor, and this is important for me that the other side, from the neurologist side, to learn the update stories, and this is very good, I think so.
It was very interesting. The whole morning was very interesting, and new approaches in otorhinolaryngology are presented, really the new diagnostic and therapeutic approaches.
They are very educational, and I think that they will serve me good in my future clinical practice.